Hello, I'm Dr. James Anthony. I'm a boarded veterinary dentist that works on dogs and cats mainly, but really I work with all animals for that matter. And we're going to talk about anesthesia for surgery for dental disease. That dangerous word, anesthesia. Well, it's every pet owner's nightmare. But believe me, we as veterinarians don't want to put your pet under an anesthetic if we don't have to. But there are times that we have to for the benefit of the patient. Now, what we would do before we would even consider anesthesia is doing a full oral health exam, not oral health exam, but a full physical exam on your friend and making sure it is healthy. Part of that exam, we will probably want to do some blood work and notice if there's anything abnormal with, let's say, the kidneys, the liver, or other organs. On the health exam, if we notice, let's say, an abnormal heart rate or abnormal heart sound or lung sounds, we may want to do x-rays of the chest. We may want to do ultrasounds of the chest just to make sure it's safe to put your friend under. See, by doing these pre-procedures, it makes it as safe as possible. But we don't automatically do it on every animal. It's basically when we see a sign that is a warning sign that there could be a danger, we want to know what we're dealing with. Because by doing this, we can customize the anesthetic protocol to meet your friend's need. So in other words, we can make it as safe as possible. Because there's no such thing as a safe anesthetic. They're all dangerous. They're calculated poisons that we deal with. There's not a safe anesthetic, there's only safe anesthesiologists. And as a result, we basically want to make sure that we give the right products for the individual. On top of that, we need to, once they're under an anesthetic, we always intubate them because it's a direct line to the lungs to give oxygen for recovery. We also want an intravenous catheter in them because if something did go wrong, we can have direct lines to the blood vessels to give drugs to actually improve the overall condition of the animal if it has a crisis situation. Now, the most important thing during the procedure is monitoring. And the best monitor is our technicians. That's the best. Having somebody there watching the heart rate, feeling the blood pressure, checking the color of the animal, all these things are really, really important. Now, we have machines that can measure the rate and rhythm of the heart rate, and that we can measure the blood flow and pressure. We can check the oxygen saturation, the amount of carbon dioxide that's there, temperature, depth of anesthesia. All these things are important to do, and the more that we can monitor, the better, but the best is the technician to monitor the animal as an individual the whole time. There's a couple of different types of anesthetic machines. Basically, what we want to use is there's a rebreathing system where basically the anesthetic is circulated with gas anesthesia. Another is a non-rebreathing system where we just flow it through and it goes out into a scavenger system. And that's what we mainly use for small animals and cats. Once the procedure is finished, it's not a matter of the safety that's it's completely safe now. Recovery is very important. And what would be best is if you recover them in a very quiet area and have somebody monitor them and keep them warm. So basically what we want to do is have somebody there watching the recovery. Once they start swallowing, we normally take out the endotracheal tube and still watch them until they're fully recovered where they can walk and get around. So just tying everything up, there's no such thing as a safe drug. They're all calculated poisons. but they're safe anesthesiologists. We need to have people monitoring and use monitoring devices throughout the procedure, do that pre-anesthetic testing, and on recovery, having somebody watch the recovery period. That's how you make things safe. Can things happen? The answer is yes. But to put everything in perspective, if the proper precautions are taken before and during and after the procedure, to put it in perspective for you, it'd be more dangerous you driving your pet in the car to the practice for the surgery than them going through it.